My name is Michael Riveras. I am a leader for the infant and early childhood team here at Intact. And today we're going to do our provider and education well-being content on change. Okay, the materials in this presentation are drawn from curricula that's been developed in partnership with the colleagues from Georgetown, the University of Maryland, and our partner TA Center, the Central East Mental Health Technology Center. This presentation has been prepared by Intact under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. All materials appearing in this presentation, except taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or its authors. Citations of the sources are appreciated. Please do not reproduce or distribute this presentation for a fee without specific written authorization from Intact. This presentation will be recorded at our website. And so a little overview about who we are. We are a multidisciplinary team with several partners. The Center for Applied Research Solutions, CARS, here at Georgetown, the Center for Child and Human Development here at Georgetown, Change Matrix, the Family-Run Executive Director Leadership Association, FREDLA, the American Academy of Pediatrics, MedStar at Georgetown University Hospital. Our goal is that all children, youth, and young adults and families with emotional or behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. A little bit about who we are as far as examples. We are comprised of state and local agency leaders, mental health service workforce, social workers, psychologists, clinicians, primary care providers, school workforce, community-based providers, and the list goes on, peer supervisors. Equally important are family partners and our youth partners. This is a wonderful illustration of the services that we provide. Individual consultation, peer learning exchanges, such as the one you're joining today, customized coaching, training academies, and the list goes on. We have podcasts. We are really trying to appeal to the learning needs of this community and find out ways to be more informative and helpful. So if you know of if you have an idea about a way that we can reach a group that would be helpful, please let us know. And we will facilitate today's presentation. When we talk about change, so often as professionals, be as clinicians or educators, we talk about change and helping others. And one of the things about change is that what is appropriate for the people that we work with is also appropriate for ourselves. And so in this quick little story, Damien was kicked out of 3 childcare centers for aggressive behavior. He was often seen as the bad kid. And so his mom and grandmother brought him in and said, we really want to get him some help. Sadly, they had identified Damien as a bad child before he was born. And I had to ask, why name him Damien if you thought he was bad before he was born? As it turned out, it was his father's name. But Damien would get really aggressive with so many other students and consequently had to change schools several times. Well, when they met with me, I saw this really nice young man who was happy playing, and I said, he's actually got some very good behavior right now. How do you recognize that? And I was like, and they laughed and they said, he'll do something bad. And I said, but we are going to recognize the good behavior. So this represented the change with mom and grandmom, helping identify and celebrate the good things that this little boy was doing. And as it turned out, they at first laughed at me, but then they kind of got into it because little by little, they were seeing positive changes. Well, they met with me twice a week for about 6 weeks. And all of a sudden, they stopped. And I didn't see them for several years. As a matter of fact, it was almost 15 years later when I was in a grocery store that the mother approached me. And by that time, I had become an assistant professor and was doing some things with the media, and they would see me on TV from time to time. And she said, "Mr. Michael, you don't remember me?" And I was like, "Your face is familiar, but," and she said, "I'm Dudu's mom," because that was his nickname. I said, "Oh, Damien." And she said, "You saved his life." I said, "I know, I only saw him for about a month and a half." And she said, "Let me tell you something. I'm studying psychology now. And what you were telling my mom and me was so important for us to follow. And that was to celebrate the positive behaviors. And as much as we laughed and we made fun of you when you weren't around, it was, we saw that he really liked being um, celebrated for doing good things. And his next school, he became identified as a good kid. And all the teachers have always loved him." And then she said, "Doo-doo." And this 6'8" kid in high school who had gotten football offers from the great institution of LSU where I was working, and also got one from a not so great place, the University of Alabama. And he had full rides, but he wanted to play music. And the strange thing was that he too said, "You are the man that they always tell me changed my life. Thank you." He was such a nice young man. And I would hope that any of you who are working with young children have that opportunity when you're just being yourself and you run into a child who is now an adult who thanks you for that. But if we're talking about change, and we're talking about how it works, that concept of here's this family grappling with a negative behavior and taking a chance on doing this really positive thing of celebrating these small, positive, pro-social behaviors that the child was making. And it worked for them. But here's the challenge for us today. Let's talk about a time when we ourselves have had to make a change and what that has been like. And again, technically, we're talking about the same things, but now we're turning the lens around on us. And so what I would like for you to do, and we have our Jamboard that we're going to put up.
For folks who are not on our last session, on our first session of the COP, we were able to take a self-assessment called the Poise. So for those of you who didn't get a chance to take it, we'll go ahead and post that link into the chat. And the Poise sort of helped us examine the different components of well-being that you see on the screen here. So I'll just briefly review them. That physical well-being involves getting restful, rejuvenating sleep, developing a healthy diet, getting exercises, and just sort of positive restorative practices such as integrating art and music into your daily life. Occupational well-being, so kind of following up on the example that Mike just gave us about, an approach to Mike's practice of working with a kid with challenging behavior. That could be one area of occupational growth, but it could be kind of whatever you could do in your profession to like and enjoy what you could do, including addressing stress in your work environment, addressing obstacles in your workplace, and thinking through ways to center your work and find meaning in it. Then we also had this area of intellectual well-being, kind of exploring your spirituality, comparing what you do with what you value. So I think there are interconnections between some of these different areas of well-being. So, and I especially am seeing that between the occupational and intellectual. Social well-being comes from getting along well with others and maintaining good relationships, sort of kind of practices that are helpful in moving relationships along and moving conversations along, like asking open-ended questions and giving affirmations. So those of us who are clinically trained got a lot of this in our clinical training. And then emotional well-being, which involves sort of regulating our emotions, experiencing pleasant emotions and being able to manage difficult feelings, kind of achieving emotional well-being and working on coping skills. So a lot of the strategies that Mike was talking about that he worked with Damien and other kids and families that he has worked on and that he has worked with, and I know that a lot of you have also worked on. So the Poise assessment sort of covered those different domains of well-being. We were all able to take it, and folks who weren't able to take it last time can take it whenever you want. You have the link, and you'll see the results after taking it. You'll be able to examine those results yourself. We wanted to kind of, now that we've thought about, by taking the Poise and by just thinking about those different domains of well-being, we wanted to go ahead and talk about how to frame goals in one of those areas that you may have self-identified through taking the Poise as kind of an area that you may want to improve in working towards overall wellness. So we know that we know even from what folks pasted into the Jamboard that it can be difficult to make changes, but there are also lots of good approaches that could help you make changes. I like what somebody wrote about being able to ask for help and being able to be patient with oneself as well as others as sort of moving towards ways to move forward on wellness goals and change. So there's this whole people change model that we just wanted to review briefly, and I'll go through the changes really quickly here. So there's this pre-contemplation phase where there's actually a person is not ready to make a change. And an example of that might be like sort of if a person has a relationship goal, and you might come across this in your clinical work, a person who's at the stage, or a client who's at the stage where, they might say to you, me and my partner are fighting a lot, but every relationship is hard and everyone goes through rough patches. So there's nothing I need to do right now. I'm just going to wait it out. So that person is not ready to make a change quite yet. Then there's a contemplation phase that comes next here, where a person is ambivalent about change and sees both the pros and cons and may recognize the need, but doesn't see like any reason to act quickly. So, right, it could be with the same example of a relationship issue, and I'm going to get in trouble with Shai because Shai is actually somebody who's a relationship scientist, but I'll go with this example for a moment, and Shai should jump in if it doesn't make sense. Somebody who might say to you, a client who might say to you, I hate fighting with my partner. I don't even remember the last time we had fun together, but there's nothing I could do about it. Maybe we can work on this when, if you're an educator, when the school year is over, or when I have a break from work, but I don't have the emotional wherewithal to work on this right now. So a person is seeing the need for change, but is not able to move to that place yet. Then we get into the preparation stage where, a person might be resolving ambivalence and deciding actually to make a change. So your client might say to you, or you might say to yourself, I'm really tired of feeling this way. I don't want the stress of kind of this relationship stress to rule my life. And I need to find a way to be happier with my partner. So now a person is ready to make a change. So then we move into the action phase of making a change, kind of working on some resolution toward the problem. So maybe it could be, for this example that we're working with, somebody asked their spouse to come to somebody like Shai and to come to couples counseling, or kind of work with somebody like Benjamin and explore a mindfulness class together. So kind of work to kind of come up with a plan to move forward with making a change. The maintenance phase, just what we know from the research is to maintain a successful behavior for that person who is sort of doing something engaging to get over this bad place with their partner. If they're able to if folks are able to implement a change and put it in place with these action steps, if they're able to do that for 6 months, they're a lot less likely to relapse into the kind of difficult situation that prompted the change. So, I mean, I think we just wanted you to sort of keep this in mind as you think about making a change toward your own wellness. And I feel like, just in the interest of time, if folks have, any comments about experience working with folks in these different phases of change, or even if you yourself feel like you're kind of on a trajectory, in this kind of stages of change, I mean, feel free to share it in the chat, for the benefit of all our colleagues here. I'm going to go ahead and move on. so that we can get through our content here today. Like, here's a sample scenario that we wanted to just look at really quickly together. We just thought about a relationship example, but here's another example of somebody, of a client, or it could be one of our learners here today, wanting to exercise more often, but by the time you get off work, you're really tired, you need some time to unwind, and then it's really hard to get up and do something, where it gets to be late in the evening, go out for a run, kind of do an exercise, something with your Fitbit or fitness tracker, when it gets to be so late in the evening after you've had a really long day of listening to other people's problems for a lot of us. What do you think will happen in this situation, like, based on where this person might be, thinking about the stage of change? And anyone could come off mute and answer this.
Some acknowledgement that something needs to change, but not much more than that right now.
Yeah, I think that's right. So a person has this goal to exercise, to improve physical well-being, but sort of is stuck with these competing activities after work. So I think that's right, is thinking about it, but not ready to act yet. And we want you to kind of do this reflection as you think about your own goals as well. I'm going to go ahead and just show the next couple of screens really quickly, because I want us to be able to dig in and work on our own goals in the rest of the session, and Shai is going to help us with that. So I'm just going to quickly say that, right, I mean, some of the things that could contribute to resistance, and we've seen this with clients, are sort of, and we saw it in kind of that relationship example and a little bit in the exercise example, kind of, defending the current behavior. Everybody has rough patches in their relationships. It's okay. It's not out of the ordinary. I'm just going to ride it out. So kind of like the idea of kind of the difficult situation working for you, and being good enough. Some denial, disputing any kind of evidence. We see this in sort of changing health behavior, disputing evidence that supporting the change will be helpful, avoiding, and I think that came into the chat a little bit, like with somebody wanting to make a change and saying, I'll work on it next week, and then next week never comes. So there are some things that are tough with trying to make change, that we've experienced in ourselves and with our clients. Some strategies that we found have been helpful in sort of avoiding resistance and embracing change are sort of thinking about the problem through a number of different lenses, kind of reflecting back. Really, is this really good enough the way things are going now? Has it really been helpful, for your overall functioning and health, to keep things as they are? And also looking forward, what would things look like if I made this change? What would be the impact on my professional functioning and personal functioning if I went ahead and made this change? And sort of just different ways to consider the importance and do some kind of consideration of pros and cons, like knowing that sometimes a pro is going to outweigh lots of other pros, and the same could happen with a con. Like, I feel like, from a personal ground and like making changes in physical health, I always think I need to have enough energy to keep up with my young kids. And that kind of like outweighs some of the negatives that I have about making some changes in my health. And we see this, I know that we see this with our clients and with ourselves. And I feel like part of this work that we want to do with you all is to just help us all sort of practice what we preach with clients. That was not always the case in my clinical practice, and I'm really trying at this point in my career to kind of take the time to focus on these kind of restorative practices and health goals that I've worked with clients on a lot. So that's why we're bringing this content to you, and we hope that the same for you. I'm going to go ahead and turn it over to my great colleague Shai, who's been super patient to lead us through the next part of our session here.
Awesome. Thank you, Pamela. And I just want to note that the couple example was very good. So well done. Okay, so I'm going to continue with the interactive theme that we have created for today. I know only a couple of you have videos on, but how many of you have heard of SMART goals? I imagine, okay, I'm getting some nods. This is probably not unfamiliar content, but for some of you it might be, which is great. Thank you, Jenny. Yes, all caps. Okay, so I'm just going to quickly go over what SMART goals are, and then I also want to give us an opportunity to actually put it into practice. So what does SMART goals stand for? It's an acronym. The S stands for salient, as in we want to make sure that we're choosing, when we create goals, we want to make sure we're choosing ones that are meaningful to us, and also they're easy to understand. So we can take a look at the goal and automatically know exactly what we're trying to achieve from it. The M is for measurable. So we want it to be, we want to make sure that the goal is clearly defined. So I want to do 7,000 steps as opposed to I want to walk a bunch in any given day, right? So making sure that when you look at it, you can say there's a hard line between achieving it and not achieving it. So again, defining exactly what needs to be accomplished. Great. Salient is better than specific. There is another version of SMART, which has the S standing for specific, but salient here is the one that we're using. So I'm glad that it's resonating with at least one of you. The A in SMART is for active. So we want to state what actions are needed, being very clear about what we hope to achieve, what we hope is going to come of creating this goal. R is for reachable, making sure that the goals are realistic and that they're based on your skills and experience. We don't want to, for someone who only speaks English and Spanish, we don't want to say, I want to speak fluently in German in 2 weeks. That's not realistic or necessarily reachable. And then of course, timed, which is what the T stands for. So we want a clear date for completion. We want to have a good sense of when this goal will be accomplished. Next slide, please. All right, so I'm going to break down each of the 5 domains that we've talked about thus far in this community of practice into specific goals. So for the physical domain, the example that I have here is I will exercise more often, and I just alluded to this. So I'd love some audience participation and feedback here. I'm going to read off 3 different options for a good goal for the physical domain, and I want you all to tell me which feels best and seems like the best SMART goal. So A is I will walk more next week when I can find the time. B is I will run a 5K next week. And C is I will walk at least 7,000 steps each day for the next 4 weeks and monitor my progress at the end of that 4-week period. It's probably pretty obvious because one sentence is longer and more specific. And I've already gotten some answers for C. So that's exactly right. C is specific, it's salient, it's measurable, right? 7,000 steps. There's a clear action associated with it, 7,000 steps every day. It's reachable, right? You can do this in a month for sure. And then it's timed. We have a 4-week period at which point you're going to measure your progress. So exactly right. C is a SMART goal. Next slide, please. All right, so the next goal pertains to the occupational domain. The example I have here is I will improve my time management skills, which a lot of us can probably relate to. So again, I'm going to read all 3, and I want you all to tell me which one feels like the best SMART goal. A is I will complete my client notes by the end of each school day. B, I will complete my client notes each school day by 7 p.m. and monitor my progress for 2 weeks. And C is I will complete all of my work before the weekend. B is more specific, it's salient, it has a clear time period at which point you will assess how things are going. That's exactly right. B is the answer here. Please. All right, for the intellectual domain, the example is I will spend time reading about the most common issues that come up in my work with students/clients, for example, disabilities, delays, relational concerns, therapeutic techniques, etc. So I'll just spend some more time digging deeper into my field. 3 SMART goal options. A is I will become an expert about autism by the end of the school year. B is I will read 3 resources about kids on the autism spectrum in school settings this month. C is I will read more about what the outcomes are for kids with autism. So B, again, in this case, is specific, it's salient, it's realistic, it's measurable, and also it's timed, right? We have a specific time period to achieve this goal. For the social domain, thank you, Pamela. The example is I will connect with friends more often this semester. Let's really ramp up our social connectedness, especially in the context of a pandemic. I think this is a great goal. A is I will invite 2 friends to take a walk or grab some coffee after school each month and monitor my progress after 2 months. B is I will invite 5 friends to walk or get coffee each week and monitor my progress for 2 months. C is I will invite 3 friends to walk or get coffee. The correct answer is A, because let's look at B actually. I will invite 5 friends to walk or get coffee each week and monitor my progress for 2 months. I don't know how realistic or reachable that is, which is the biggest problem, right? 5 is basically saying either you can invite 5 friends in one day, or you can invite a friend a day over the course of the week. But that's just a lot of people to try to connect with in a short period of time. So when you say over the course of a month, I'll invite at least 2 friends to walk or get coffee and then monitor my progress after 2 months, that feels more like, okay, if I don't make it out with any friends in any given week, I'm not going to beat myself up over it. All right. And the last one, next slide, please, is emotional. So the example here is I will work to better regulate my emotional response during stressful times. Great. Options. A is when I feel distressed, I will continue doing whatever I'm doing. B is when I feel distressed, I will regroup and pick up where I left off in 5 minutes, and I'll monitor my progress for 4 weeks. C is when I feel distressed, I will take the day off and will monitor my progress after 4 weeks. B is correct. I just want to touch on C really quickly. I think C is also measurable in some ways, but taking the day off when you feel distressed is not very realistic. So B, we have a clear time period, 4 weeks. You have a clear action plan. I will take a break for 5 minutes and I'll come back. It feels very realistic to me and it's salient. What I ask is that you come up with a SMART goal for one of the dimensions that you identified as a growth area.
Here's our information. Here's all the ways you could get in touch with us. Close out the session with, thank you all. We really appreciate you taking the time to spend with us this afternoon.